Welcome everybody to this first episode of Psychology 101. We want to thank all of you for making this possible. On today's episode, we'll be talking about addictions. Are addictions moral defects or diseases? Stay with us and find out what the community has to say about this topic. We also invited an important guest today, a professional psychologist that will share all the information and opinions she has about the topic. We also want to let you know that everybody in this video agreed to be part of the show. Well, now we have Kieran with important news for us.
I always told them that, but they've never listened, so it's like, oh, we're live? Alright. Thank you, Beatrice. Today's segment of Fight the Facts is about addiction. Is it a moral defect or a medical disease? The article, Addiction, Medical Disease or Moral Defect, Stigma, Attribution, and Cultural Models of Addiction Casualty in a University Population by Nicole L. Henderson and William W. Dressler, explores the cultural models of addiction casualties and their relationship with the stigma among university students at the University of Alabama. Here are some key points. The cultural models of addiction. Among students, the study finds a common but disputed cultural model of addiction causation. The 5 themes of biological self-medication, family, social, and hedonistic factors are included in this paradigm. Medical versus moral morals. The medical model and the moral model were found to be 2 main centerpieces of the cultural model. The moral model sees addiction as a product of societal and personal causes, while the medical model sees addiction as impacted by uncontrollable variables, examples like biology or just self-medication. The stigma attribution. The level of stigma attached to the people with the substance use disorders depends on whether the moral or medical model is followed. Supporters of the moral model dismiss more people because they perceive addiction as a loss of self-control. These people who support the medical model, on the other hand, see addiction as a health problem and assign less stigma to it. The impact of drug education, according to the study, the moral model heavy curriculum that is now in place may unintentionally promote stigma by encouraging the idea that addiction is the result of personal failings. People may become discouraged from treatment due to fear of being judged. Now back to this thing. The impact of drug education. According to the study, the implications for treatment and education. In order to decrease stigma, it is important to incorporate more medical and self-medication viewpoints into educational programs. According to the research, gaining insight into the diverse cultural models of addiction can enhance the success of treatments that focus on treating and supporting those struggling with substance disorders. The study by Nicole L. Henderson and William Dressler reveals that university students' beliefs about addiction are shaped by 2 primary cultural models, the medical model and the moral model. These models have a big impact on the stigma attached to people who struggle with drug use problems. Students who follow the medical model, which sees a struggle with drug problems. Students who follow the medical model, which sees addiction as a health condition, attach less stigma to those who follow the moral model, which sees addiction as a personal failure. The results imply that the ethical viewpoints frequently emphasized in current drug education may unintentionally promote a stigma. Educational programs should include more material on the medical and psychological elements of addiction to counteract this. Identifying addiction as a medical illness can lessen the stigma and foster a more accepting atmosphere for those seeking treatment. Ultimately, More effective prevention and intervention techniques can result in an in-depth knowledge of cultural attitudes around addiction. That is it for my segment. Thank you, America. And now back to the people in the field.
Thank you so much, Kieran, for the fascinating news. Now we have Ruth walking around the community asking you guys what you think about one of the most common addictions, drugs. Go ahead, Ruth. Let's hear what the people have to say.
Hello. Who do we have with us today?
Pauline Hafer. I'm a physician assistant at CareSpot.
Nice to meet you. I wanted to ask you a few questions related to drug addiction.
Okay.
My first question is, do you think lack of willpower is a big factor of drug addictions, and why?
I do not, actually. I think it's more so upbringing, education, that kind of thing. I've treated a lot of patients in my past who have addictive habits, and a part of it is, our healthcare system. I think part of us have failed in the past in treating our patients. From what I've seen, we tend to prescribe a lot of overuse of narcotics and anti-anxiety medications, benzos, that kind of thing. And it's very easy for patients to get addicted and not realize they're becoming addicted at that time. So no, I don't believe that it's a lack of willpower. I think it's more of the addiction and the overexposure to these meds.
Okay, thank you. And my last question is, do you think that drugs are more likely to affect someone with an addictive personality, and why?
Oh, of course, yes. It's kind of like the 12 steps, for an alcoholic. They may go from, how commonly do you see that the patients will go from their drinking addiction to smoking? There's that addictive behavior. So yes, they are very easy to get addicted to other things because there's always, there's multiple things out there that can get them addicted, but there's always something else. There's that need for that, after dinner drink or after dinner cigarette, or I'm out with my friends, I need to have a cocktail in my hand, or I smoke marijuana every time I'm with my friends. It's in a very habitual, addictive personality.
Thank you so much. Thank you. Who do we have with us today?
MJ.
All right, MJ, I have a few questions about drug use. My first question is, why do you think depression is a big factor to become a drug addict?
Because when people are depressed, people are more tend to try to find a way to deal with the depression, so they usually either use drugs or do other things other than they just trying to find a way just to not deal with it. So usually it leads to doing drugs and then becoming addicted because they enjoy the feeling, or they enjoy how it makes them feel. Right.
I agree. My next question is, do you think drug addiction is more common in low-income areas, and why?
Is it more common in low-income areas? I think it's more spoke upon in low-income areas because they don't have nothing to lose, but I think drug addiction is just common everywhere, because even drug addiction is not about, how am I supposed to say it? In low-income areas, is it more common? Not really. I just think that it's more spoke upon, because in the higher income areas, it's kind of frowned upon to look at somebody that does drugs often. It's more frowned upon.
Okay. My last question is, do you think childhood exposure to drugs leads to usage of drugs later in life, and why?
It's 50-50. Sometimes yes, because it's it might be two people that see the same thing, and then one person's you know what, because I've seen that means this is my life and that's what I want to do, and then another person might be hey, I've seen that life and I don't want it, and I'm going down another route. So it's 50-50.
Okay, thank you so much. Back to you guys in the studio.
Thank you, Ruth, for interviewing some of the members of our community. Now we have Noah with breaking news.
This just in. Breaking news coming to you at 12:45 p.m. A new survey called Addiction, Identity, and Morality has just released by Brian D. Earp. The study shows that addiction challenges our usual ideas of growing up and being responsible for our actions. By studying how addiction messes with our brain, emotions, and surroundings, they show how it can be hard for people who are addicted to feel in control and make good choices. They also explain how addiction can mess with a person's relationship and change how they act, often more than just realizing they have a problem. People struggling with addiction can feel torn between who they really are and what their addiction is making them do, leading to conflict between how they see themselves morally and how they behave. Based on these insights, Brian D. Earp suggests that society needs to change how we see addiction. They argue that a more compassionate and thoughtful approach that focuses on understanding and helping people instead of just punishing them should be taken. They say that it's important for creating a better environment where people can recover and improve. By exploring how addiction affects identity and morality, Earp and his team encourage readers to start thinking differently and understand people's experiences a little bit better. They want people to see the complexity of addiction and realize how important it is to show empathy, support, and share responsibility in dealing with this big social problem.
Thank you, Noah, for the breaking news. Now we have Kelvin interviewing more members of our community.
I'm here at Ruby Tuesdays to question some individuals on the topic of addiction. I'm joined here with...
My name is Trent Rydell.
Hello, Trent. Do you know what addiction is?
It is, I think, either the physical or psychological dependence on some sort of an external drug or behavior.
Okay, that's good. Do you or anyone in your life suffer from addiction?
I've had a few family members, yes.
Okay. And so, do you think addiction is genetic or a moral defect?
I think I read somewhere that something like 80% of our behaviors can usually be explained by genetics. So I think I have to lean more towards the genetic side.
Okay, got it. So, do you think that there's such a good thing as a good drug or a bad drug?
I mean, it depends on your definition of drug, I guess. I'd say, like, there's medications out there that people depend on to save their lives, or they addicted to it. I mean, I guess technically, people would die without their insulin or that kind of thing. So yeah, I guess there are good drugs.
Okay. Would you trust a drug addict?
I think it's a little more of a case-by-case basis. I think there are different levels of addiction and there are different types of addiction. So, like, would I trust a heroin addict coming up to my car window at Walmart asking if he could hold $100 for me till next week? No, I probably wouldn't trust that. But,
I'm joined here with
Amaya.
It's nice to meet you, Amaya. Starting off, do you know what addiction is?
Basically, it's like, when you use something and, like, you gotta use it, gotta continue to use it, you feel me? Yeah.
So, do you or do anyone you know in your life suffer from an addiction?
No.
Okay. And do you believe addiction is genetic or it's a moral defect?
It is both. Reason being is because if your mom's a crackhead and she does crack while you're in the stomach, you're gonna be a crackhead. And then
I'm joined here with
Mackenzie.
Okay, Mackenzie. Do you know what addiction is?
Yes.
Okay. And do you believe addiction is a moral defect or a genetic thing?
I think it's both.
Both?
I think cases vary. I think there's people, I myself, I come from parents that are alcoholics.
Yeah.
They've also partaken in drugs and partied. At least on an alcohol addiction side, I definitely feel a little more inclined to drink, but I think that's from seeing parents who covered and like used alcohol as a way to kind of like, oh, life sucks. You drink about it, And so I definitely see that in myself. I kind of sometimes can do that. As far as drug-wise, I don't have a lot of that in my family. But I do think the same thing can be said with drugs. If you grow up in an environment where it's seen or you're raised in an environment where it's not taken seriously and it's used and abused, I think it's easy for you to fall into habits, kind of, you know.
And so that was our last participant of the day. This is Kelvin Nera at Psychology 101. Back to you guys at the studio.
Thank you so much, Kelvin, for that wonderful interview. Now, for the final part of our segment, we have the interview with the psychologist Karen Christensen. Hello, we're here today talking to the psychologist Karen Christensen, right? And we're gonna talk about addictions. So, how are you today?
I'm fine. I'm fine. I'm Karen, and I have an interesting background. I did my bachelor's degree at Villanova University many years ago, and then I went back for a master's degree at NYU, and I did that in psychiatric nursing. At that point, they didn't have what they have today, where you can be, a nurse assistant or something in one of these fields. You just had clinical education or leadership. So I did the clinical route. And then I felt when I graduated that I really didn't have any personal experience. I wasn't ever treating patients. So I didn't feel safe. So I went to a 4-year program. It was called the Institute for Gestalt Psychotherapy and Training. And that way I was trained with live patients, and they didn't let you graduate until they felt you were really comfortable with patients. So I was very, very happy for that experience.
Wow, that's excellent. So we're here today to talk about addiction, and I have a few questions for you.
Sure.
And maybe, hear your point of view about all this.
Okay.
So the first question is, how important is drug addiction education in the early teenage stage?
Okay, I would say it probably starts before even early teenage. I believe that probably there should be drug education in the schools even before a kid becomes a teenager, because I think once you're a teenager, the hormones change, and kids are very connected to their peers, and that's, I think, where some of the drug addiction happens.
All right. Do you believe that hiding the truth about drugs from your younger teens is a safe move to protect them?
No, I don't think you should ever hide information. I think children that grow up in a family where they have parents that will talk to them, that, and it's something that I see in my practice, a lot of patients never felt they were seen or heard. So very important that they have parents that will listen to them, that will hear them, and also support them and talk to them. So I think it really should, be done.
Yeah. All right, then will you consider addictions a disease or a moral defect?
Okay, I think it's probably a disease. I have several older alcoholic patients, and I think it is definitely a disease. Also, it has a genetic component. I mean, I think you can see it in a very low-income neighborhood, but you can also see it, as I see it in New York, with very wealthy parents who really don't monitor their children at all. They're working or they're out having fun, and their kids, raise themselves. And then they get into these groups, and before you know it, they're going down a bad path.
All right, yeah.
And I think it can be mixed with, many times I think people get addicted because they're depressed and they want to just feel better, dull their pain. I see people with general anxiety disorders that are very anxious that take medication or that take drugs. I think I have 2 bipolar patients who are both alcoholics. So I think it can be mixed with other, and personality disorders too.
Yes. So what do you think is an addiction? What is an addiction?
Well, an addiction is, I think, first of all, instead of being able to handle your emotions and be able to talk to somebody, you desperately crave some type of relief. and therefore you get addicted to either a drug or to alcohol. Also, you could be addicted to food. You could be a workaholic, addicted to work. But I think it's, really just not having anything else and a dependency on something that's going to help you.
Okay. And one last question to finish here. How can we help someone who suffers from an addiction?
Okay, I think it's a very long process. It really should begin, first of all, in the home, and it should begin at school. But I think once somebody is addicted, first of all, they're probably going to need a hospitalization to have some type of withdrawal. And then once they're more stable, then they can go to a rehab facility where they can be educated, where there's family support. And I think what's very important too is to have a sponsor, to have one of my patients, and this was the very first patient I ever had, came to me. She stopped drinking. She came to me once a week. She was in a group once a week, and she had a sponsor that she talked to every day. And after 14 years, she never, during the whole time we were in therapy, took another drop of alcohol.
Wow.
But it's very hard because so many of them relapse, and because they just don't follow the program. They think they know that they can get better on their own, and it's very sad to watch them relapse. And families can't help because they resent help usually.
That's right.
But I think if there are supportive friends around, then I think that's another area where if people have support, then they can get through it.
Well, thank you so much for this.
You're so welcome.
Thank you so much for being part of the program.
Absolutely.
No
I wish you all the best luck.
Thank you.
Yeah.
And well, thank you so much for being part of this. Thank you so much for watching this first episode of Psychology 101. We hope you guys enjoy it at home, and we'll see you soon.